This time, there is no debate about whether all Americans should have quality, affordable health care. The only question is how.
Obviously, Secretary Clinton has a full plate. She has a lot of tasks in front of her, but she had a pivotal role in the early 90s and knows it, as you just stated, better than just about anybody. Should she be used in some way when it comes to health care reform?
I don't know if she can be. She's pretty busy now. Well, you know, she's interested in it. We both keep up with it, and I bet you she and the president will have some personal conversations about it. But the other thing that I didn't mention was she and I have been criticized for presenting a bill to the Congress, and President Obama is going to use the Secretary of Health and Human Services, Governor Sebelius, to negotiate with Congress and let them do the bill. That is clearly the better way to do it, but everybody's forgotten that we offered to let Congress write the bill, and we offered Senator Dole the chance to do a bipartisan bill. The chairman of the House Ways and Means Committee at that time, Congressman Rostenkowski, insisted that we present a bill because he said the Congress was so unfamiliar with all the details, they could do better amending our bill than coming up with a bill on their own. So we did that because the Congress insisted on it, the leadership did. I think now you have a much higher level of literacy in the Senate and the House, and in both parties, than you did when we tried before. Because people have been coming to grips with this, and we made a lot of progress. You know, we did the Children's Health Insurance Program and all that. So, you know, she may have some insights on this, but the playing field they're on and the number of members of Congress who know enough about this to be really constructive players is much, much better. And she's pretty busy, so if he asked her, I'm sure she'd love to talk about it. We talk about it a lot. We care about it, but they'll do fine. Yeah, we talk about it a lot, but I think they're going to do fine.
Let's drill down specifically on something you said earlier. When it comes to sort of creating these silos of healthcare reform, you have sort of single payers and more governmental involvement on one end, free market involvement solely on the other end. Single payer never has really caught traction politically. Is it politically unpalatable, or is it a bad idea?
Well, I think it's more politically unpalatable than it is a bad idea, because single payer is not socialized medicine. Canada has a single payer system and a private healthcare provider system. Our single payer systems are Medicare and Medicaid, sure. And Medicare is quite popular. The good thing about single payer is the administrative costs are quite low. We probably waste $200 billion a year between the insurance administrative costs, the doctors and other healthcare providers' administrative costs, and employers' administrative costs in healthcare that we would not waste if we had any other country's system. On the other hand, if you look at the experience of Germany, France, Japan, that don't have pure single-payer systems, they have more mixed systems, their costs are actually slightly lower overall than Canada's. So there's something to be said for having a mixed system if you can get the administrative costs down, because then the systems have enough competition in them to try to restrain cost, and it's not all up to the political bodies. In Canada, because it's all financed through the government, it's more difficult sometimes for the politicians to say no than for just the regular management of the healthcare system to cut the cost. So I think you can have a mixed system. If you look at the French system, which scores very high on every international measure, it's mostly publicly financed, but there's enough private in there that there's some tension that's creative and positive.
Do you think there is a degradation in quality of care with the single-payer system? Is that a concern? Should that be a concern?
Well, there's no evidence of that in Canada that I'm aware of, except for excessive delays, which they always try to come to grips with. The British, you know, do have a completely government-run system, but they allow people who can afford it to get outside the system. And they've also started running hospitals almost like charter schools in America. That is, they have these trust hospitals that perform very well, and therefore they're given more control over setting their priorities, specializing, and cutting delays. There are all kinds of different ways to do it, but first you do have to cover everybody, and then you have to stop people from gaming the system. There's a lot of gaming going on now in the American system so that we spend more than anybody else and get less for it. I think that once you get to universal coverage, I think the health insurers then could play a more positive role than they do now, which is often involved in, you know, they make a lot of money through saying no, and through the inordinate paperwork burdens that are put on doctors and hospitals and other providers.
One is about the insurance industry that you just brought up. They tried to scuttle the healthcare reform plan of '93. Now they're saying we also believe in universal healthcare. A politically tactile question, I guess. Are you buying it? You think they're being honest?
I think some of them really do want it, yes. If you look at their new organization, the person who heads it came out of a progressive background and favored, as a philosophical matter, coverage. Secondly, I think they now understand that in terms of the health of America and the well-being of our economy, we can't go on basically giving them more and more dollars every year, the insurance industry, and getting people sicker and sicker and leaving more and more people behind. I mean, look at all the healthcare problems. The childhood obesity problem, which is my obsession, is the most glaring manifestation of a system that treats sick people and doesn't keep people well. And that's one where I think, by the way, we get broad bipartisan support on trying to do more on wellness, and that will save money. I think the insurance industry realizes that a lot of the smarter ones realize that they could kill the goose that ate the golden egg here, that America can no longer go on spending more money and getting less for it and having all this money go to them, and that they can make a lot of money and do well by making us healthier at a more affordable price.
We have a common task and a common challenge.
Why can't we see that we are all in this together?